Hi everyone, my name is Dr. Tashambi and the name of my channel is Dr. Tashambi Speaks. So let me tell you a little bit about how this channel derived. People are always asking questions about nursing. They have tons of questions about what do I do when I retire? How do I retire safely? What's best practice when I'm on a clinical unit? How do I know what's a good unit to go to? How do I know what's a good hospital to work at? So, because of all those questions, I have a place where you all can send questions to me and I will address the questions on my YouTube channel. So, you can send your questions to drtashambispeaks@gmail.com. So the question today is, I passed my NCLEX examination, now what? So the profession of nursing is a complex intermingle of a variety of systems. And oftentimes nurses, be it novice nurses, probably like you, or senior nurses, sometimes we don't know how to navigate through all of those moving parts. And the dynamics of a healthcare system or organization, it can be a bit overwhelming. And if you are not careful, you will fall into, I'm just going along to get along. And when you fall into that trap, what happens is you stifle your creativity, you stifle your ability to be liberated as far as your thought is concerned, and it can also lead to burnout. So the question becomes, how do you avoid this? So I have 3 things I want to tell you you can do in order to avoid being that nurse that's just a go along, get along king or queen. Number 1, you have to understand your organization. Who's in charge? What is the role of the charge nurse? What is the role of the nurse manager? Who's the president? Who's the chief nursing officer? People should be able to wake you up in the middle of the night and you should have an answer to those questions. Now, does your organization practice what we call a just culture? What is a just culture? A just culture is a culture that uses a model, whereas if you make a mistake, are they apt to fire you because you made your first mistake? Or is it an organization that says, you know what this person did not cause anyone to lose their life, so we're going to coach them and we're going to help them to become better. That's important. Number 2, understand a bit about your unit's budget, how we are paid, and what determines a loss or a gain. So you might think to yourself, they're not going to open up their checkbook and tell me how much the company makes and how much they're spending on our unit. Well, you can go to town hall meetings. You need to know if your company is a for-profit or a non-profit organization. And with that being said, a unit is ran just like a house is. So if you see people washing their patient and throwing washcloths in the garbage can, you know what? There's your raise. Your raise just went in the garbage can. If you see people taking dressing changes or 4x4s because they have a family member with a wound at home, there goes your raise. Now, we're not saying become a snitch. Old-fashioned saying says what? Snitches get stitches. So we're not trying to cause you to get stitches, but we are trying to put you in a situation where you kind of pay attention to what's going on your unit. And if you see that there's a lot of practices that are going on that could potentially cause your unit to have a loss, you want to decide, should I plan a nice exit strategy? Why? Because your unit could end up being closed down if it's costing too much to keep it running. Thank you. Just remember, follow me on Instagram at Dr. Tashambi Speaks.